Okay, before we get started, I do want to do some proud introductions. I'm honored and very privileged to introduce you to a couple of people who are with me. Well, yeah.
You don't want to start clicking it. So.
Oh, did I click that?
Couple.
All right, so my introductions first. In this room with us, I have Tom Pritchard. Tom is an MST therapist who's been with us since 2000 as well. Pretty much 6 months after I started, he was with the research project first, and came over to MST Standard. I'm honored to have him with us. He's brilliant, and really to be with us for that long. It's amazing. With Tom, my esteemed guest, we have Vila. Really, really honored. Vila is a family. She's a sister to a young man we had working with us a while back. And we're going to have the opportunity for Vila to talk about this amazing work she did. Just so proud to have her here. And when you hear what she did and how hard she worked, I hope you'll be as proud of the work that she did as I am. With Vila, I've also, we have young Vila. And we also have Ms. Mia, who's kind enough to join us to help us with any interpretive services in case we need them throughout this process. Okay. On Kauai, hi guys, I don't know if you can hear us or see us, and at some point, hopefully we can transfer them over. If we can't do it right now, that's fine, we'll get to them. We have Paige Javier, who's our MST supervisor over there. She's been with us about, I'm gonna say 3 years. Could be 2, could be 4. Paige is probably yelling right now and I can't see her. And she's also, we're so lucky to have her. And with Paige is a father who has been kind enough to come join us, named Tom, so this is going to get nice and confusing. And I'm so looking forward to him telling us what's been going on and how hard he worked for his son. So we do have the privilege of having these amazing families with us. So, to get things going, what I do want to do is set the stage for how this is going to go. And I know time, and so someone's going to have to also keep me in check, because I do train, but I train for 8 hours. And so an hour and a half is kind of like, Gina, shut up. Okay, so stop talking and stop walking, or there'll be somebody's responsibility here, okay? So, there's a couple of, let me roll out how I want to do this. I know some of you are very familiar with MST, and some of you may not be. So I tried to do a little bit of both. If you are familiar with MST, bear with me as I do some bare bones. If you're not familiar with MST, it is bare bones. So see me at the end, we can always talk about having some more information later on. So what I'd like to do is give you a little bit of background on MST. From there, we'll talk about how we do the model, the research that underlies the model. Then we'll move into working with our families, and they can show you how that research moves into the daily application. And then if we have some time, I would like to talk a little bit about MST and substitutes, finishing up with an opportunity for us to have questions. So hopefully that's cool with everybody. And we can begin. So what are we? Community-based, family-driven treatment for antisocial delinquent behavior, pretty basic, just like any other in-home service. Focuses on empowering caregivers to solve current and future problems. Nothing new with that, but what's important to take away is the future problem aspect of this. We are only about a 5-month service. Our kids come to us and they have multiple problems. So the situation is, at the end of the 5 months, the behaviors are not going to be eradicated. Our goal is that at the end of treatment, our caregivers know what to do. They have the skills necessary to handle those behaviors as they occur in the future. And hopefully, over time, then we'll see an eradication of those behaviors. Or at least diminish to the point that the kids are functioning enough. That, it's just different levels of behavior. MST client is the entire ecology of the youth, and highly structured clinical supervision and quality assurance processes. So basically, anyone can say they're doing MST, but unless you're getting weekly supervision and consultation, you're not doing MST. And there's a highly structured weekly supervision and consultation that goes along with this. Okay, I'm sticking with this. Okay, so we're based on the theory of social ecology. How many of you guys are familiar with Bronfenbrenner? Yay, okay. So what Bronfenbrenner basically tells us, right, are that behaviors are multi-determined and bidirectional. So he came up with a schematic to show us our kid at the center and the various systems that affect our kids' behaviors. So what do you see here? You see not only what systems are involved, but the relative power associated with these systems. Okay. So what you'll also notice is we're all the way out there with provider agency. So the amount of power we actually have on shaping that youth behavior is very little. The most amount of power falls into our family and our caregiver. The bidirectional nature comes in when you think about it, right? You think about the caregiver and the child as an example. We may get a parent who comes to us who's harsh in their parenting skill. But you find out later that this parent may have had appropriate levels of discipline until our child started showing behaviors such as aggression and running away. All of a sudden, as a result of that youth's behavior, our parent ends up showing more harsh discipline practices, maybe for lack of knowledge of knowing what to do, maybe for their own frustration. That, in turn, then affects the kids running away again. It's a reciprocity that's occurring. You're also going to see that these systems interact and affect this youth's behavior as well. You take an example of home and school. If the home and school don't like each other, that interaction is also going to affect that kid's behavior. They don't like each other, maybe they don't talk. They don't talk, our kid digs out and doesn't go to school. So these various systems interplay and affect the youth's behavior, and this is basically Bronfenbrenner's theory. And that sets the stage for MST. So, what is our referral criteria? Who do we accept? Kids 12 to 17 years of age, risk of placement, involved in DJJ, those who have committed sex offenses in conjunction with other behaviors, those with substance abuse, who's exclusionary, those who are living independently, sex offending in the absence of other behavior, those with moderate to severe autism, so lower end would actually fit our criteria. Actively homicidal, suicidal, or psychotic. Actively meaning at the point of referral. So if they need out-of-home placement, we are not a replacement. But if at the time of referral, things are stable, then a kid who has had history of can be referred. And youth with psychiatric problems are the primary reason leading to referral. Okay? All right, so how are we implemented? These are the strategies we draw from. So we basically use the evidence-based strategies or research-based strategies. Continuing on. We have a single therapist who works intensively with 4 to 6 families at a time. 5 is our caseload. Team of 2 to 4 plus the supervisor. Our clinicians work 24 hours a day, 7 days a week.
Well, we're available, but
Yeah.
we don't work.
They're in the house 24, but they are available 24/7, and they really are. And this is a way of removing any barriers to access, as well as being there to help a family through crisis, or help to develop interventions. Think of it from the standpoint of if you have a kid who's struggling with getting to school, right? The best way to assess is to be there when the kid gets up in the morning. So clinician may go there at 6 a.m. and help identify with the family, what does it look like? How do you wake that child up? What is the interaction? Or if the kid digs out at 1 o'clock in the morning, or there's an argument that becomes physical or is starting to become physical, the phone call is made to the clinician. The clinician will make the determination, do I come down? Or can I help you through a crisis plan? How do we make that determination together? They're available throughout the time. 3 to 5 months is the typical treatment. And we do work in the community home, etc. We also deliver all treatment. Typically, no or few services are being brokered or referred outside. Never-ending focus on engagement and alignment with everybody, including probation, school, neighbors. We have a strong track record of client retention. We must be able to have the clinical lead. So let me clarify this a little bit, because sometimes there's this weird kind of perception about us and clinical lead and a couple things. A lot of that has to do with engagement, and it has to do with assessment. So first and foremost, these clinicians are trained in various forms of what's necessary. They're trained in marital, they're trained in substance abuse, they're trained in cognitive behavioral therapy. Of course, nobody's an expert in all those areas, but they do work as a team. So they have team members, some who are stronger in certain areas or not, and there's consultation and supervision every week to help them with interventions in each of those areas. So they are strongly suited in taking the lead in all of those various domains. That being said, the primary reason we don't broker out is when a family comes to us, they are highly overwhelmed. They typically have multiple kids. They typically are working a few jobs. We got our kid who's acting out, acting a fool, breaking things, going to court, not showing up, possibly becoming aggressive. Maybe our caregiver has their own mental health and substance abuse issues. And then we come in and we're saying, I need you to try these interventions. And these interventions are going to cause your kid to probably get more aggressive first, right? It's that pushback towards homeostasis. And then someone says, you know what, but we're going to give you a couple more services. How likely is it that we're going to sustain engagement with this family if they're already worn out and now they got to go to 3 more appointments during the week? So during this time, we're just looking at it from the standpoint of let's at least have this opportunity to give these parents a break or these caregivers a break without adding too much more to their plate. The other part is about assessment. Every week, these clinicians are doing a new treatment plan. Every week is a brand new treatment plan. And what they're doing with their treatment plan is they're assessing their interventions. Did my intervention work? Did it not work? If so, why? What's my next step? If not, I'm going to start again. If we have multiple services in play, then how will I know if it's my intervention or not? Then am I going to be sustaining something that actually may not be good or may not be effective for the family? So it's really those factors that are the reason why we're looking about clinical lead. So we move on to the core elements of MST. So let's talk a little bit about the specifics of MST itself. We have our principles, our AP, our analytical process, and the quality assurance system. I'm going to start with our principles. We have 9 principles. Our 9 principles are how we develop our interventions. Okay? Every intervention is developed with these 9 principles in mind. And then treatment adherence is measured with these 9 principles. Every month, the families are called and And the families then rate their clinicians about the 9 principles. See how they're doing. And what we've identified through research is the better those scales, those ratings are, the higher they are, the better the outcomes for our family. Pretty simple. So our first principle is finding the fit. This is the cornerstone of our assessment process. This is the easiest thing in the world. Very simple, but it's so helpful for us. Our fit circle is what helps us to assess a behavior. All we're doing is defining the behavior. We put the behavior in the center of a fit, and we're saying from all the systems in which this kid is embedded, identify every factor from each of those systems that may be the cause of why this kid is acting out. Right? So we're using that research. We're saying those various systems and what is happening in each of those systems that's causing this kid to do that. So Kim's substance use, from each of those systems, what's causing Kim to use? Nothing special about it, but pretty transparent. And then from each of these factors, or drivers that we like to call, what we're going to do is take each of them and from each we develop an intervention. So every driver has a specific intervention, depending on, of course, prioritization and when it has to happen. So that's our first. Our next one, very simple, positive and strength focused. Our contact should emphasize the positive and should use systemic strengths. This is where we look for what works for our family, cultural aspects or cultural competence. We increase responsibility. We look at how we design interventions to promote responsible and decrease irresponsible behavior among family members, including the kid. Present-focused, action-oriented, and well-defined. Interventions should be present-focused and action-oriented, targeting specific and well-defined problems. I do want to spend a moment here. When we do our fit, and the reason I bring this up is because of the trauma driver, and I think I just want to put this out there to everybody. So when we do a fit, we look at, very often, you'll have a driver related to maybe something that historically happened to one of our youth. A trauma-related driver. Our goal in MST is shape the behavior in the moment. Doesn't mean that that driver related to trauma is not something that doesn't need to be addressed. What we will do is address it when we identify that that's what needs to be prioritized at that moment. Typically, though, we're going to focus in what is occurring to stop that behavior right now. So if we went back to Kim's substance use and we did that fit, and we saw in her fit, she has low monitoring by mom, she gets access from her community, a couple drivers from there. The reason why Kim is smoking marijuana today is because Kim has money, she has substances, and mom's not watching her. So if I can stop her from using today, and I can change that parent-child interaction, it's very possible that we can just get her to stop using drugs. That's where my interventions are going to be. And possibly what you're going to find, especially with young kids, that the drivers related to some of those cognitions will actually subside. And then at this age, you don't necessarily, at least research has shown that we don't have to necessarily at this moment address that with them if the behaviors are held at bay. Now, if we've identified those other drivers, implemented all those drivers with efficacy, so we have evidence that they've all been addressed, and yet we can't get Kim to diminish her substance use, then I'm going to start saying maybe it's more something a little bit deeper that we have to address right now. Maybe there's something going on that just needs to change. But everything right now is we're going to focus on the present. What can we do to change that behavior? Okay. Our next one then is targeting sequences. It's the basics of family therapy, right? We're going to look at the sequences. We're going to see where in the sequence can we intervene earliest to help this family stop that behavior. Very simple. And then developmentally appropriate. Intervention should be developmentally appropriate to fit the needs of both the family and the kids. Continuous effort. They should be designed to require daily or weekly effort by all family members. Evaluation and accountability. Our interventions are evaluated by multiple perspectives. So even though our family says, yeah, it went well, everything's fine, I followed through, I called the school, right? We do the trust but verify. I'm gonna call the school and just double check, right? Not that I don't want to believe, but you just never know. There's lots of things that get in the way. Or maybe a lack of understanding. Maybe mom did call the school, but she didn't actually ask the questions necessary. And then we find out that I developed the wrong intervention. I really screwed up. And then finally, the last principle is generalizability. Intervention should be designed to promote treatment generalization and long-term maintenance of therapeutic change. What we're doing with this is all our interventions have in mind that they're going to be done by the parent. Everything is done when the parent is in the lead. So that we're not taking the lead, they're intervening, they're the ones learning how to do it, they're going to be me at the end of treatment. And that brings us to the analytical process. So the next slide is actually how we do what we do. So this is called the analytical process, or the do loop. Do loop is also built on computer programming, or where it was considered do until. I think that's kind of what I am. So basically, this is how MST rolls out. We gather a referral behavior, comes to us with a frequency, intensity, and duration. From there, we gather the desired outcomes of everyone. The family, the care coordinator, the PO, the auntie, the uncle, the school, no matter. We put them all together, and we develop our overarching goals. Our overarching goals. What do we want to see at the end of our 5 months? Clearly defined, with evidence. How will we know we've met our goal? We then move into the fit. Every referral behavior gets that fit assessment. That fit assessment is also done on every interaction. Parent-child, marital, whatever. It's also done on interactions between systems. Homeschool link, peer-parent link. It's done on interactions between you and somebody in the system. Care coordinator didn't get back to me. Not aligned with probation officer. It's done when something goes right. Mom followed through. Done when something goes wrong. Kid threw a chair out the window. Every time something happens, we do a fit circle. From there, we're going to prioritize. Priority of that fit circle, the 4 P's of prioritization. Prerequisite. What do you have to address first before you can address anything else? Priority. What does the family see as the most important driver? Powerful. What is on all my fits? So if I'm looking at all my referral behaviors and I see low monitoring on every single referral fit, I'm going to say, that may be a powerful driver. And then the precursor one, what happens right before that behavior occurs? And start taking that in. From there, I develop my IG, or intermediary goal. So I prioritize, say I land on low monitoring. My goal then will be I will increase monitoring. Mom will increase her monitoring. Something that can be met, a week, couple weeks, that's my focus. Under there is my intervention development. Who will do it? What will be done? Based on those evidence or research-based services, cognitive behavioral, all those various things, should be done in a couple days. based on the 9 principles. We then implement and we measure. We're going to measure every single one of those interventions. Did it work? Did it not work? Back to a thing. And this gets done every week on every intervention, and that's how we do what we do. And as you'll see, should I just walk with this? Okay, so environment of alignment and engagement. It's not a stage, but an entirety. Because none of this happens without our family. Engagement is ongoing. They have to be the lead. And we know it waxes and wanes, so engagement is going to be ongoing throughout. Okay. So now that you know how we do what we do, I just want to take a couple minutes to talk about the research behind what we do. This is the causal model. The causal model is based on 50 years of research. And what the causal model tells us is that there are various risk factors that cause delinquency in a kiddo. These risk factors come from the kid, the family, the school, the community, and most specifically, the delinquent peers, right? So what the schematic basically tells us is that if we address the family and school indirectly address delinquency through the delinquent peers. So in MST, we're going to address both of those domains in an effort to change that delinquent peer domain. It also tells us if you have an understanding of what the risk factors are, you're more likely then to prevent delinquency in the first place, right? So, there you go. Let's better understand a little bit more about the risk factors. So under each of those domains, research has told us that these are the prioritized risk factors. Under the family level, poor parental supervision, inconsistent or lax discipline, poor effective relations between the youth, caregivers, and siblings, parental substance use, and mental health problems. Now, in all of these areas, it doesn't mean that all your families will have these, but this is what research tells us are the most prevalent, right? We're going to look for them, but we may find there's different ones for our family, or they may have some or not. The peer level, association with drug using and or delinquent peers, or relationship with peers, peer rejection, and that, again, this is the most powerful predictor of our kiddos' delinquent behavior. A kiddo hanging out with other delinquent peers is going to cause delinquency. That's just what research has said. School, academic difficulties, low grades, having been retained, behavioral problems at school, truancy, suspensions, negative attitude towards school, and attending a school that does not flex to youth needs. Community, the availability of weapons and drugs, high environmental and psychosocial stress, and neighborhood transients. And finally, our kiddo. ADHD, impulsivity, positive attitude toward delinquency and substance use, and lack of guilt for transgressions or negative affect. These make pretty much sense. I mean, it feels transparent when you think about it, right? And yet, somehow, unless we see it on paper, you go, oh, yeah. Okay, and so that brings us to our theory of change. This goes along hand in hand with Roth and Brenner's concentric circles that basically tell us to get our best results, your interventions need to be able to address an interplay of risk factors, right? Not just one, but multiple risk factors. So in MST, what we're going to do is we're going to work with that family to address those multiple risk factors in an effort to reduce that antisocial behavior. Because what do we know? We know that that family is the key to shaping those kiddos' behaviors. So we're going to build on the strengths of that family. We're going to work with that family to improve their own family interactions. We're going to work on that family child. interaction. We're gonna work on family communication. We're gonna work on family supervision. We're gonna work on family discipline. We're gonna work then on how the family works with the school on communication, works on monitoring the peers, peer-parent link, works on getting the kid into pro-social or helps to monitor in the community. All in an effort to reduce this behavior and improve family function. So now that we've seen this, we lost Fila just in time.
Yeah, she's got a young child and they had to go to the bathroom.
I gotcha, okay.
It's part of the realities when you work with families.
That's right. Timing is perfect. She should be here in a second. So,
But thankfully, Nia has let them know.
yes, and you can explain anyways before we
Do
get.
you want me to begin
Yes,
the
yeah,
referral
that'd be
behaviors and
perfect.
stuff?
Yeah,
Okay.
so what we're gonna do now is now that you see this theory of change, I'm gonna bring Tom up when Vila comes back. I mean, this is the time for you guys to have Vila. I'm gonna stop talking for a period of time. And what I want you to see is how this theory of change actually rolls out into the real world situation. And we're gonna use Vila to explain the situation with her brother Ivona, okay? And to get it started, Tom is gonna come up and he's gonna start explaining to us some of the history of the case. Tom, I'll just stay here and run through the.
Sure, so
the
if you want
slides
to
and
move
you
to the
can-
first, Vila doesn't have to be here, she knows what the behaviors were. So
Yeah, and
But
then,
whenever she arrives, and Nia's going to help with interpretation because Vila's first language is Tongan, and that has been very helpful to be able to give her an opportunity to express in her own language, how she feels and what was working. Thanks. So I'm very, first of all, she's not here right now, but I'm very thankful and very blessed to have worked with Nia as well as the family. Nia was a pivotal part actually of helping me engage and connect with the family. She was very, very supportive and very, very instructive to me about how to do that. Thanks a lot for coming back. Appreciate it. Thanks a lot, Vila. Thanks, Vila, Junior. Ivona is Vila's younger brother, actually youngest brother, right? Yeah. Is he your youngest? He's the baby. And Vila's the responsible older sister. So the referral behaviors are often the beginning stages of how we determine, as Gina had expressed earlier, how we determine whether they're the right fit for the MST program. So clearly they are within the criteria of inclusion criteria. Ivona had a history of substance use. He was using marijuana, methamphetamines on a daily basis. He was engaged in runaway behavior several times over the past year for as long as up to 2 months. But he was gone so often, in fact, he was almost like homeless, living with homeless people, that he missed all of the first half of the school year, 2017 and 18. It's truancy. So these were the 3 primary identified referral behaviors that we were going to work together on with the family on getting him back on track. So we always define our goals in a very concrete, observable, measurable way. So these are the 3 overarching goals that the family agreed to and the team agreed to help out with Ivona. That he would maintain a clean and sober lifestyle, as evidenced by at least 4 clean UA tests, and reliable collateral reports from family and community members. So we had very measurable, objective stuff through clean UA testing. I just want to add a little caveat. When he got involved with our program, he was already, we don't like to involve multiple providers, but because of his very chronic, serious history of substance use, and he was already part of the court system, juvenile drug court was a referral that was already engaged with the family. So we do work very well with juvenile drug court because it's very much a collaboration and they have their piece that they do and we always communicate and work together. And they're respectful of our program and we're respectful of theirs, so it doesn't become too confusing for the family. We're all kind of working this together. The youth will follow curfew and home guidelines established by Dad and Vila, making sure that he doesn't run away or he's not AWOL during MST. These are all the, we call them the overarching goals, or the goals that we're hoping to achieve during treatment and by the end of treatment. The youth will attend school at least 80% of the time and receive passing grades as evidenced by reliable school parent and community reports. Now, some people might say 80%, like why wouldn't he be attending 100% of the time? Here's a youth that actually didn't attend school for 100% of the time. So to shift it up to 4 out of 5 days was a reasonable, measurable, realistic goal that we could achieve in 3 to 5 months. So for the sake of this particular presentation and training, we were going to focus on, as Gina talked about, the fit circle, specifically substance abuse, because that was the targeted behavior that was seen as a primary barrier for his success, and it overlapped in all the other areas. So when I sat down with Villa and with the family, and we talked with everybody, Dad and everybody, and Ivona as well, we came up with reasons why. This is part of the assessment piece of why he was engaged in substance use. He was coping with a lot of loss and sadness, frustration. He was definitely hanging around with negative peers and associating with substance using peers, and as Gina pointed out, that's always a very proximal or primary driver. He was on homeless runaway status a lot of the time, and his girlfriend happened to be a serious substance user. He had a lot of unsupervised time. Obviously, he's truant, he's not going to school, he's not involved in pro-social activities. Low monitoring in the sense that Dad works on Molokai full-time, and he comes home on weekends. So he had to pull in other family members, especially Villa, but other family members to do the intervention of parenting for. And of course, he had access and opportunity in the community. You know, substances are readily available, unfortunately, so easily, and it was available. And there was a history of substance use in the extended family, based upon the family's report. You know, in the extended family, there was history of substance use.
So I think at this point, what we're gonna do is,
Sure.
we're gonna ask, run through some, and allow Villa to kind of tell us how she was able to address a lot of these drivers, just to make it a little bit easier. I know Tom was gonna
Sure.
help her with some questions. That way Nia could be helpful and make it a little bit simpler rather than just,
Right.
going crazy. But we wanted to at least talk about how these drivers were addressed, and she can talk to you about how she handled it. She did a brilliant job.
I have a tendency, like I think that Villa, along with other family members, often underreport all the efforts that they've done. I don't think they fully take enough credit for the action plan and the steps that they've taken sometimes. And so I just want to help her along the way with the help of Nia as well. So I'm just going to ask Villa a little bit about, we'll talk story a little bit about how you got involved originally as Ivona's guardian. How did that happen exactly, and how were you pulled in by Dad? How did that all happen, that you became his guardian?
The first time, my parents called and I go back to me. I needed mom. And I told her a few months. Yeah, I'm coming. But very soon, my parents called me. I gotta move back. I need mom. From there, I told her, 2015, my mom said, I'm coming home. But very soon, she moved to be in now. This is my mom's job. Everything is happening. My mom said, we have to do all this. From there, then, 2015, so happy. My mom then moved here home. And we did everything to here now. Hospital. This is my mom's job. Everything is happening every Friday. I have until now he's still a family. And my dad so happy when I moved here.
So initially, mom, as she's explained, when
Hospital.
mom left and moved to Tonga, she didn't hear.
Every Friday until now he's still calling.
And Vila had the responsibility and was asked by Dad to come and provide caregiving. And so initially, mom, as she's explained, his mom left and moved to Tonga, in case you didn't hear. He was in control. Dad had to maintain his job. And then Vila had the responsibility and was asked by Dad to provide caregiving. So eventually, for ever since her younger 2015, 16, he was really in control. Dad had to maintain his job. So in the beginning, I'm sure it was really, really challenging, thankfully, to take on that responsibility because she says, since parents' job, that's my mom's job. 15, 16, she was moved to this position as a family member here. So Dad wanted you there. In the beginning, I'm sure it was really, really challenging, right, to take on that responsibility because she says, that's really parents' job. That's my mom's job. How come I've been put in this position as a family member? You felt your dad wanted you there and answered his call.
It was hard for my dad. Appreciate because my dad calling every day until now. How about Ivana? And this was hard for me that kind of about me. Every morning I have to wake up, call this appreciate because my dad 4 in the morning to 6 in the morning. Every day until now I had to call this about Ivana. And the school called me, this never dropped us about me. I had to do all that. Every morning I had to wake up, call this call. 4 in the morning to 6 in the morning. I had to do that. I know I had to call the school, excuse me, but I had to do that. Every single thing in my family, I have to do that. But I try to monitor and my back. And my dad said.
So Vila has taken on a lot of responsibility. Thankfully, she does have extended family and
Every
some
single
support in the family.
thing in my family, I have to do that.
And
Fly to Maui,
how did you sit down and define? You told me a little bit about this. We know that. So Vila has taken. How did you sit down and respond? Or when would you meet? Thankfully, she does have extended family and some support in responsibilities. How did you do that? And how did you sit down and define? You told me a little bit about this. We know that you. How did you sit down? Or when would you meet as a family to define your roles and your levels of support and responsibilities? How did you do that as a family?
sometimes we don't want to talk about it. Every when dad talk, we all have family. We don't talk like that. Pretty soon you guys will talk about my family, honor, talking about my mom. Sometimes we don't want to.
So there was a communication plan. Not only would you have family meetings on Sunday, but you also communicated with your dad.
Talk like that. Pretty soon you guys will talk like that.
So there was a communication plan. Not only would you have family meetings on Sunday, but you also communicated with your dad during the week, right? So I know there were a tremendous number of barriers that got in the way that led to involved substance use. And one of the most important things was there was some feelings of being unsafe in the home or in the community. So I know there were a tremendous number of barriers that got extended family members that led to involved substance use. And one of the most important things was there was some feelings of being unsafe in the home or in the community outside because of other adult extended family members or cousins who were in the area. Right?
nawangan tu ibin mo yang mo na wag saving na ko ba iati dela fa matama ko fica ako ba pa rin ako ni fato
Remember some of the steps you took with your auntie, or to make sure things were safe? Remember some of the steps you took with your auntie, or to make sure things were safe?
In my room, the window pane is open. One day, I was when I look at it, I went upstairs my house, and I asked staff, "Did you see somebody open the window?" Came home and it died. It's one of my cousins. I look in my room, my desk side, pane is open. They all look at me, went upstairs. I went upstairs my house, and I asked her, "Did you see somebody open the window?" His tablet, one of my cousins. On the desk side, I called about every and then my auntie took the tea opened my window. I'm inside. So that's the sister's after that stuff. My his tablet. When I see that, I called about everybody. And then my auntie took the tear out. She's still in there. That's the sister's son. So we all happy when my sister over there. And the family had a lot of scared of them. The only thing I do, I tried to make my with the family safe, call the car, and now she's still in there. Like that, and then we all happy when I still over there. And the family downstairs, they're all scared of them. First time, lost it. Anything I do, I just make my family safe. Crime, call the car, and then do the report and everything like that. And then I call Ivana. When they happen this, it's nothing bad because it's the first time. Lost of everything in my room. And I called my dad. My dad was let it crying. Really soon I forget everything. And all my brother came. When they happen this, it's nothing for me. I just called the cop and was in the house. And then I let it call in the house. Really soon I forget everything. And all my brother came.
If I can sort of put it in less emotional terms, but you know, in essence, Villa and her auntie did a fabulous, fantastic job of getting interventions. They had adult cousins who used to do like chop, mopeds. If I can sort of put it in less emotional, they would just sort of take charge, but had a sense of entitlement. Villa sort of be in front of at the family home, fantastic, all kinds of illegal activities. They had adult cousins who used to do like chop. One of the primary things we do mopeds and furniture plays, they would just sort of take charge and had the sense of entitlement to sort of be in front of at the family home. And it's really hard to do some of these interventions. And drug use, so I give tremendous credit. So, and one of the primary things we do with the family and support the family on is safety. And if you don't feel safe in your own home, and you have adults around you, having a sense of danger, then it's really hard to do some of these interventions. So I give tremendous credit, and Nia was there along the way with Lisa involved, with Villa, and with Court, and with Auntie to apply for the TRO, and Ivana really shifted it ever since. He needs to support his family now, and he was home to help Villa out, and also get Lisa involved, and he was much more aligned with Lisa at this point, realizing these people were bad influences on that part of the family. So it's been effective ever since. In fact, you're saying some of them are down in CCC because of other charges. So I just give them tremendous, because it's tough to have to deal with your family, I'm sure, but people safety is not so I just give them tremendous, Because it's tough to have to deal with your family, I'm sure, but safety is number one, right, for everybody else. The other thing that Gina has pointed out quite clearly is that the powerful influence of negative peers and substance using peers. And when Ivona was not living at home, he did connect up with some substance using. The other thing that Gina has pointed out quite clearly is that there was a substance powerful peer influence of negative peers and substance using peers at their home. And when Ivona was not living at home, he did connect up with himself. Some of the steps she took. In fact, he had a girlfriend ensure that he was a substance using peer and was not involved in substance use, but still didn't immediately cut off the relationship. And I wonder if Villa could kind of explain a little bit of some of the steps she took, did some other interventions to ensure that Ivona substance use was not involved in substance use, but still didn't immediately cut off the relationship, realizing that that might not be effective. But did some other interventions to eliminate substance use.
That the children check the bag. I find a small bag. It's my little brother wanna have a tummy bag older than that the children went to the truck. And I checked the bag. I find out. So I find it 2 times and buy the truck. And Ivana was supposed to hang around in detail like that. I cracked the pipe from there, and I told him that my cousin left the house. I find no one time to post the truck for me, warning her, and Ivana needs to hang around. He got tired going every Friday. From there, Friday, I will take him all the way to come out. The cousin left the house. From there, he knows what is. All day I checked the bag, warning her stuff. Maybe time. Now, she left her going every Friday to or every Friday. I had to take her all the way to Copperlake. I warning you. From there, when I see you today, I checked the bag, I find another stuff in the house. So now, she left. And she left to Oregon. You want to left long time from my house. I called her, I warning you. When I see you 2 times, after meeting, I talk to you. Every time I call you, you are home and left the house. Then you want to know? I did. I called the drug test. He goes to drug test. He cleaned up. He goes now. After meeting, I talk to him. Every time I call you, you are home at 6 o'clock. I have to let him from one time to okay. I called the teacher. Not I he bought it. That's what. Now you listen now. I'm telling you, every time I dad talk to check out, it's okay. Yeah, 6 o'clock, going home. I have to let him. One time when I leave the house, I not my auntie or my sister. And now you listen now. If you wanna have more time. Every time my dad talk to check out, it's okay. Yeah, every time you wanna home, let him. Oh, this is my mom. Sometimes when I leave the house, I have to call my auntie. When I met sister, I feel sorry for Chick. If you got my long time, I would just talk to him. Listen about that. Every time I met, oh, this is my mom's house. I don't want to do that. Sometimes when I met, I feel sorry for him because my mom is not here. I was just talking. Forget about that. I still do it. I met, I still love that. I still do that.
I think what Mom has to, what Villa has to say is much more powerful than what I have to say. But I'm going to put I think she kind of underreports some of the stuff she did, which was fantastic by her story. Initially this girlfriend was living in the home, right? And so Villa was in a dilemma knowing that she was still using substances, but she knew that if she tried to cut off the relationship, Ivana might elope again, he might run away with her and be homeless. So first she put some really clear rules around the home to her and saying, hey, I'm gonna be checking your bags, I'm gonna be checking Ivana's as well. You're gonna get random checks, frequent checks, and if I find drugs, in the bag, it's gonna be flushed, it's gonna be removed, and you're gonna have to leave too. So initially she was very compassionate. I think maybe the first time she discovered the girlfriend having drugs, she said, you cannot stay here overnight anymore. You cannot. She was 21, by the way, girlfriend, or an adult anyway, 19. So you cannot be here. So she said, you can only be here on these terms and no drugs are allowed in the home. Daytime, short term, that's it. And then eventually, I guess she said, you cannot stay overnight at all. So she worked really hard on the monitoring piece. She's also sharing how much she checked with the school, confirmed things were happening, that he was following through, linking up with the home school, all of that kind of stuff. So tremendous effort on Billa's part, but she gave the girl a chance. I would go to the home and I would see the girlfriend there, and she was recognizing that Ivana was changing and she needed to change too. Now how much she changed by the end of treatment, I'm not sure, but she got a part-time job, she was doing a lot better, and he was definitely testing clean. He was staying away from drugs, so there's some really objective and subjective evidence of him doing that.
So I want to bring this because I know this has been,
Yeah,
and it's been a lot for Viva. And as you can see, even though it's been a while, and she was successful, it's an emotional ride, right? This is an emotional roller coaster. And in the beginning you go, oh my God, did it work? Yeah, but it doesn't mean it's easy, right? So I want to first thank again Ms. Vila for even being willing to put yourself out there and to discuss it. Because nobody likes to discuss it, right? No one wants to go back and talk about it. And it's ongoing. I think what you want to hear is even though the kid's testing clean, she still does it, right? We're hearing her say it's not ending. It doesn't end tomorrow. He may test clean, but I'm still doing it. I still got to call Auntie and say, hey, are you monitoring him? I'm not home today. Is somebody watching to make sure he's home? I still got to test him, make sure that he's clean. I still got to check make sure he's going to school. It doesn't go away, right? But it's better when they're clean. You don't have to deal with all the other stuff and then all the time in the background. So I really appreciate it.
Thank you.
And so, do we have Kauai, or is that not going to happen? So, because I do.
They can hear us, but I'm not sure if we can hear them.
I'm not sure if we'll be able to present with Kauai today. We're having some bandwidth issues. I'm not sure if we'd be able to get them to display in.
Okay.
Sorry about that.
Does Villa want to share a little bit about, I know JDC is still involved, Juvenile Drug Court, but, some of the things that Yvonne is doing now compared to which, he's doing a lot better in a lot of areas, right? With you?
Ivana, you changed now. You want to try. You're going to school. I called the school. The teacher called me like twice a day about him. Because I checked him. Because I told him, you have homework. No, my teacher told me to do homework on the computer. Okay, I'm going to call the teacher. The teacher said, yeah, Ivana is right. He's doing the work on the computer now. Because he's taking a class. Ready to make his score go up. And then every time he wanna come, you have homework. As my sister said, oh maybe he doesn't have homework because he just goes to school for something or doing something. No, don't worry, just leave him alone. And he wanna say, no, come look at my bag. I have this homework and everything. But for now, every time we go to the court, he clean his desk and I talk to the BO talks to me, but everyone is good. I think it's good too. But
And what did he do last summer? Maybe you can share what he was able to do.
before he worked at Time Supermarket, when he had something happened to his hand, and I had to take him to the hospital, and then had to use the letter and then Felix doesn't want to remove, but he applied another job, but he needs to do his ID. I have to help him how to do that this time.
But he did work for an extended period of time in the summertime at Times City working as his first job, and he was doing very well.
Just to let you know, he almost came today. We were on the fence, you know, but it's an awkward situation. It's, you know, nobody wants to hear about everything, and, you know, but he was on the verge of coming. So, almost dead, young Ivona. So,
And I felt blessed again, like I said, to work with his family because not only Vila, but there's tremendous warmth and care within the family. And meeting Dad and him pulling me Vila, but you know, there's an auntie who lives in the home, and she has younger children. And here we go. Here's one right here, and so there's a lot of family members to support and to help out with. But there's tremendous warmth and caring within the family. So I felt kind of lucky to have all of those strengths to work with, including Vila. And Yvonne is he can be quite well spoken to if he chooses to be. He's very approachable.
as we come to a close, if you do have questions, is there a way for Paige to respond, or?
You're still doing great, but you're still hanging in there.
Right.
So still be live. She should be able to hear you and respond.
Can you hear me?
Oh, yeah.
Oh, okay, perfect. Okay, so any questions for me, for these guys, for the fabulous people we have with us? This is for everybody who's on anywhere or anything. So we have the opportunity for anyone, or are we going to Bruno Mars?
So part of the fit circle is the barrier of technology sometimes gets in the way of human interventions.
Yes, ma'am.
So I'm wondering if your brother and this young boy had IEPs, are they considered kids with disabilities?
Was Ivona, he was an IEP?
What, I'm reading the teacher.
Tom, did John have an IEP?
I don't know, I not really saw. Yeah, he had good grades, so I don't believe that he have a family plan. He has a modification plan.
If the teachers didn't know how to label it, it was enough to get the teacher, but we didn't bother getting specific one that was dependent on
I think in anything he had a 504 plan, but not an IEP.
My observation is that sometimes you folks have a little bit more clout talking to DOE people than parents do, than siblings do, and I think it's great that you are sent in as a point person, but sometimes you don't get as much support as if there is a team, you know, a collaborative team working on it. I don't know how well you are interfacing with Department of Education folks, or Loki Hunter folks.
Well, multi-hunter quad, but yeah, for sure. So DOE is part of our partnership, right? So we look at DOE as part of our system. And so much like our care coordinator who is a referral source or probation, DOE is also going to be our partner. So our clinicians are going to be attending meetings or going to know the teachers or doing assessments in those sessions. And typically, they're going to work with the families and going out there and helping our families to be collaborative with them. But because they're kind of our client system over time, we're not an advocate for our family because we're going to be working within DOE as part of our family system.
But we can sometimes help them find resources to find an advocate.
Absolutely. When
To
necessary.
sit in at the table with them if they feel they're not getting the services for their youth or their family that they need.
But for sure, if we've identified, so say Ivona did not have an IEP, and we have identified that he for sure needed one, we would help mom, sister, get in and ask for them, and we would help her to get him one. Paige on Hawaii, actually, Paige, if you don't mind me talking about you, comes from the Department of Ed. So her background is actually DOE, so she's embedded in that system anyway.
Is Paige part of school-based behavioral health?
You were SBBH?
Oh, great.
Yeah.
No, she's asked.
Yeah, so she is part of that process. But yeah, for sure, that's part of what we would help with.
I have a question.
I hope you don't mind me asking you this. It sounds like this is a huge effort. In some ways, it really imposed on you. It asked a lot of you, and it's still emotional for you. So I'm wondering if you feel like the changes in your brother are worth what you had to put out.
話現咗個大嘅話，我係個環個片啊，會費難大。個小個嘅呢個阿婆係阿婆呢，呢啲個個係呢，有咩個父母會買落去嗰陣，會攞佢嚟費，我包呢。
So what?
Yeah, question. For Ivona, I know you guys had addressed some of the drivers, the fit factors, right? But how did you get Ivona to like comply with all this structure that you were bringing in? Because you said he had a history of running away, right? And so how did you get him to be like just going with the flow almost? I mean, I know it wasn't easy, but instead of him just digging out and running away or just not going to school anymore.
You be talking and sharing with your sister, helping you, forcing you and auntie, forcing you to go to school. Because my mom is not here and asked me to help you folks.
And I
we
think,
all helped you.
sorry, yeah, they all did. And he even spent some time in Molokai with Dad and reconnected with him and established, not that he didn't have a relationship, but strengthened the relationship with Dad. He visited, everybody in the family sort of pulled in, and he got and there's a lot of warmth and connection between Vila and Ivana now. But there wasn't at one time, right? It was kind of upsetting and difficult to deal with him, but he has really shifted. He recognized all the benefits that people were doing for him. Like, this is, sometimes it's an exceptional family to have so many. Vila is the lead, but Dad and everybody pulling in and helping Ivana, it really helped shift his perception and his behavior. And he wanted to change too, I think.
And if I can speak, remember we talked about the 4 P's of prioritization. If I can speak a little bit, drug use was one of the primary factors to why this kid was taken out, right? So if you can handle the drug use, then more likely to get the kid stay home. So by getting him to diminish his drug use, and one of the great ways you did that was by, even though we had the negative fear of that girlfriend, but she didn't kick the girlfriend out. What she did is she said, I know this girlfriend's going to be a problem, but instead of saying you can't hang out here, I'm going to take you in and I'm going to monitor you, I'm going to put rules on you, and I'm going to put limits on you. This way, I'm in charge of what's happening here. And this way Ivana can say, oh, what do you mean my girlfriend's not allowed and I'm going to dig out with her, right? But instead, I brought her in and I got my hold on her. And by doing that, we diminished the substance use and ultimately.
And we can't underestimate not only Villa's hard work and the family's hard work, but JDC was involved
JDC
as well.
was helpful
So,
too,
I mean,
yeah.
obviously he's held accountable through court every week, and he's given rewards, recognition, and all of that. So I think the structure and the follow-through by everybody, especially the family, but the other systems also involved, start saying, well, I better get my act together. But also, this is helpful to me. He was gaining insight, and he was recognizing the benefits of it, to the point where he was aligned with the police, and he was helping his sister get rid of the negative peers in the area and everything. So he just made a dramatic shift, I thought, with sister solving other family members.
just to, I worked with Warner from the very beginning when he got involved in this. But I noticed every time Tom would come around, he would check, how do you do that? We can have a movie ticket. And a smile goes up. Or, as a reward, it's a huge difference. You made him happy and more willing to do things.
Yeah.
And likewise, when the judge compliments him, good job, Pastor, you made, it's a huge difference in his business. So, reward.
Contingencies, rewards, recognition.
Well, it's amazing what it is. I know Paige had told me when we talked about John's case, what made a difference, because if you remember from the fit, similarly, a little bit different was in regard to like the movie tickets and stuff, but similarly, I think, if I'm correct, Paige, you can correct me if I'm wrong, what John's case is that level of public spending time with Dad was very important to him. And so,
Yes.
yeah, and so Dad actually went on to help coach, right? And so there was that.
Yeah, the record.
Yeah, so Tom went and he started helping to coach and talk about a positive reinforcer for this kid, right? Now he's got more time with Dad. So it's not just we talk about it as this warmth piece. It's not necessarily warmth. It's landing on a positive reinforcement piece. It's what that kid finds the most enforcing. In that case, in John's case, it's about, I really want to spend time with my dad. And we can predict what the drivers are. There's a lot of kids, right? I'm sure he kind of felt a little shuffled in the mix with so many, etc. But now he's got this time with his father. That's pretty awesome. So, nice job. Nice job. Any other questions? Because I know we're taking you over already. So, anything else from anyone? Anyone over in Timbuktu land over there? I don't even know who that is, because I'm not sure who's around. So, well, can you look at the chat? Is there any? I don't know. There's.
No questions on my end.
No, thank you.
Okay.
Okay.
Well, I do want to say first, thank you again for the special presenters.